After first proper disinfection, we perform local anesthesia with lidocaine. As in this patient, the only affected side is the right side. We will do 3 PRP injections in this area together with the harvested stem cells. We prior marked the regions in which the most pain occurred, as well as on pressure, as well as confirmed by MRI on the day before. After waiting for a while for superficial anesthesia, we will go for deep anesthesia. And before injecting the PRP and the stem cells, we will do a secondary disinfection with the iodine. It's important always to stay in contact with the patient, to discuss with this patient. This will reduce the fear. And a last disinfection. If this was whole?
Okay.
So all the preparations are done by now to starting the injection of the PRP with the stem cells. We have the injection needles, and according to the length of the injection needles, the single-use optic fibers. Here we have the PRP together with the stem cells, and in case if it's necessary, some lidocaine left. We marked the 3 regions, and we even can see still the injection sites from the local anesthesia. We palpate again for the processus spinosi of the spine. We of course do not want to inject into the cerebral fluid. We want to inject close to the nerve roots. Take a deep breath.
نفس عمیق بکش. حالا دوباره صاف کن.
Palpate again.
دوباره. دوباره.
And third one. Finished. So first we already can see no blood is coming back, so we didn't harm any vessel. Still we aspirate, nothing comes back, and then we inject. You may feel some pressure despite the fact that we put anesthesia. You feel something?
چیزی حس میکنی؟
یه دست انگار کمره.
You feel a wound on his back.
Feel something in the back?
Like,
And if you are in the right space and not within the facet joint, then you can inject easily without much of resistance. Then you insert the sterile single-use optic fiber.
Which option?
Blue. We have one red. So in the region where we detected clinically and on MRI imaging the most pathology, we will work with blue light, red light, and for the human eye, non-visible near-infrared light. We will change the colors. The blue light has the most anti-inflammatory effect. The red light and the infrared light enhances the boostering of the mitochondria, enhances more than 100 repair genes. At the same time? No.
If you look into the here by the cell phone, you can see infrared, okay? But normally you cannot see it by eyes. But sometimes by some of the cell phone camera, you can see infrared, and you will see that the laser is inside.
Can you put the yellow to? Yeah. In this setting, you see very nicely why the interstitial irradiation is so important. You see that the red light nicely irradiates a huge area, whereas the blue light with a short wavelength doesn't give much penetration into the tissue. The near-infrared light is not visible for the human eye. However, here in this recording, as in many cell phones, you can see a purple-like effect the human eye won't see, but the cell phone cameras, most of the cell phone cameras, will display. The near-infrared light even gives a better irradiation and a deeper penetration than the red light does. And in this patient, as he suffers from chronic neurological disease, we additionally perform intravenous yellow light irradiation. So right now, 4 different colors, 4 different wavelengths are irradiated into the patient. The yellow light is the most important color for the stimulation of nerval repair. At the same time, the yellow light enhances the production of vitamin D3, and here we want to stimulate the repair mechanisms of the bone as well, and the yellow light stimulates the production of serotonin, the joy hormone. So in this patient, we perform systemic irradiation with yellow light to boost the regenerative processes of the nervous system, and at the same time we do local irradiation with non-visible near-infrared light, non-visible for our human eye, purplish display on most of the cell phone cameras, blue light irradiation to enhance, to reduce inflammatory processes, and red light irradiation for enhancing repair mechanisms.